I'm so glad that you're here today for this childbirth education class. My name's Heidi Rice. I'm a registered nurse and childbirth educator with over 17 years of experience. So I want this to be a natural, comfortable environment. I want you guys to feel free to ask me questions or take notes. I want this to be an environment where you really feel like you can learn about your pregnancy and your upcoming labor and delivery of your baby. Before we get started, I'd like to know a little bit about you guys.
I'm Lauren, this is my husband Jared, and we are 32 weeks along expecting our baby girl.
Awesome, glad you're here.
Hey, I'm Candace.
And I am Ade.
And we are about 30 weeks along expecting a baby boy.
Congratulations.
Hi, I'm Madison. I am 31 weeks along expecting a baby girl.
Awesome, thank you. So your bodies go through many changes throughout your pregnancy as your baby is growing and developing. Every pregnancy is different, but we're gonna talk about some of those changes and some side effects you might notice because of those changes. Many women experience nausea and even vomiting during their pregnancy, especially in the first trimester. But nausea and vomiting can occur throughout a pregnancy. If this is something that you're struggling with, eating 5 or 6 frequent small meals throughout the day instead of just a couple larger meals can really help with that. Avoid spicy and greasy foods. Drink plenty of fluids. Eat meals and snacks that are a balance of carbs and protein to help your blood sugar remain at a more constant level, as an empty stomach and low blood sugar can also trigger nausea. What other kind of things are you guys experiencing in your pregnancy that you have questions or concerns about?
I'm experiencing a lot of heartburn. No matter how early I try to eat dinner, I still have heartburn at night.
Right, so it is a good idea to try to eat your last meal, a couple of hours before you're going to be laying flat in bed and trying to sleep. You can also try to sleep slightly elevated, a couple of pillows behind you to help alleviate any heartburn that you're experiencing. Eating several smaller meals throughout the day instead of one big meal at the end of the day can help cut down on the heartburn that you're experiencing as well. Because of your growing baby in uterus, putting pressure on your whole digestive tract, which can cause not only the heartburn, it can also cause constipation or even hemorrhoids. Some things that you want to do to help with that if you're experiencing constipation is make sure you're drinking plenty of water throughout the day, eating lots of fruits and leafy vegetables that will give you the fiber that you need, but also maintaining a consistent exercise routine can kind of help move everything through your digestive tract as well. Also, you never want to strain to have a bowel movement. That can cause hemorrhoids and other complications. So if you're having to strain for a bowel movement, you want to let your healthcare provider know.
I've also noticed that I've been very tired.
Yeah, that's a common complaint in pregnancy. It's very common to be exhausted the first trimester of your pregnancy as your body is going through lots of changes. So making sure that you allow time for a full 8 hours of sleep at night is very important. And taking breaks throughout the day. Put your feet up, have a glass of water. And maintaining a healthy, nutritious diet and exercise plan can also help you establish better sleep patterns too. Some women may notice a feeling of shortness of breath during their pregnancy. And that can be fairly normal because your growing baby kind of restricts your diaphragm from allowing you to take a deep, full breath. Things you can do for that is just take frequent breaks when you're climbing stairs or taking long walks. Also wear loose, unrestricted clothing to help you feel more comfortable. And sleeping on your left side can promote good blood circulation also. If you notice that you're feeling short of breath often, or it's concerning you, or this is a new symptom for you, let your healthcare provider know. So something we haven't talked about yet is frequent urination during pregnancy. I'm sure you're all experiencing and familiar with that. As your growing uterus puts some pressure on your bladder, the need to urinate more often is very common. What you want to look out for is if there's any burning during urination or even blood in your urine, which can be a sign of a urinary tract infection. You would want to let your doctor know that. Swelling can also be common during pregnancy. Your blood volume increases to support your growing baby throughout pregnancy, and so some mild swelling in your hands and feet is normal. If you're experiencing some mild swelling in your hands and feet, some things that you can do at home to help alleviate that is to take frequent breaks and put your feet up. Also, sleeping on your left side can promote good circulation during pregnancy.
I don't know about you guys, but I am a back sleeper, so I'm finding it very hard to try to stay on my left side or my right side. I wake up a lot on my back. Is that putting any danger or stress on me or the baby if I'm on my back for a long time?
So that's a common question that I get. I wouldn't want you to lose sleep over trying to make sure that you're always on your left side. I want you to try to fall asleep on your left side, and you can even put a couple of pillows or a body pillow behind your back so that when you start to roll over, you're not flat on your back, and it might even prompt you to roll back up onto your left side. Other questions?
Is there ever a time when shortness of breath may be a sign that something's wrong, like if you're just standing and you're short of breath or just sitting and you're short of breath?
Yes, thanks for asking that. Shortness of breath can be a symptom of a number of different health concerns. So if you are frequently experiencing shortness of breath, or this is a new symptom for you, or it's something that you're worried about, please talk to your healthcare provider. So it's common during pregnancy to have some body aches and pains because your growing baby is putting some stress and tension on your back muscles, your hips, some of your joints, carrying some extra weight, your center of gravity is changing a little bit. So there's some things that you can do to kind of help prevent those or to work them out when you're experiencing them. Using some positive positioning to stretch out and strengthen your back can be helpful. This is a really basic stretch that you can do on all fours to arch your spine, which stretches out all those muscles, but also strengthens them so that they're ready to carry that added weight of your growing baby. Using a positive sleep position like this can help alleviate some hips and lower back pain if you might be having that. And then this slide is showing some really great stretches that you can do to stretch out if you're having leg cramps or lower back pain, sciatica even. You can use the pigeon pose or butterfly pose if you're familiar with yoga. For those of you who don't know or haven't experienced it, sciatica pain is caused from a nerve called the sciatic nerve that runs down the back of your leg that can sometimes become compressed during pregnancy and cause shooting pains down your leg. So using some of these stretches or seeing a chiropractor with your healthcare providers, can be helpful if you're experiencing that. Another easy stretch that you can do at home to help with sciatica pain is just a seated hip stretch. You just bring the heel of one leg on top of your knee and push it down gently on your other knee to stretch that hip out. So we've talked about some of the changes that your body goes through during pregnancy and some of the side effects that you experience because of that. Next, we're going to talk more in depth about how your health and nutrition are so vitally important to your growing baby during your pregnancy.